Imagine you're an athlete with an ACL tear. You spent 9 long months in physical therapy, time and effort, just to go back out on the field and have a re-injury. Now it's going to be 9 to 12 months before you can get back to the sport you love. Now imagine you're the parent. Not only are you concerned about their emotional and physical setback, but you're staring at a high deductible insurance plan, knowing that these costs are going to roll into the new year. On top of that, the missed work, the missed school, and the continuous cycle of visits. It's overwhelming for everyone involved. There's nothing more frustrating as a physical therapist than seeing a patient after their 3rd ACL surgery or their 4th hamstring strain and 2 track and field seasons. That's why I started this company, to solve this gap. The evidence is good, the outcomes are not, because clinicians and patients lack practical ways to follow the appropriate protocols. Additionally, the current rehab data repositories are too limited and generic to serve as meaningful benchmarks. As a result, clinicians have difficulty making informed decisions on return to sport. Eccentric muscle contraction is where your muscle lengthens under tension. And eccentric exercise is a proven strengthening method, even being shown to take hamstring re-injuries from 1 in 3 to 0 at 2-year follow-up. But these are difficult to do without the right equipment at home. Currently, this type of therapy is best done in the clinic. We use a big, bulky piece of equipment, and these are even difficult to find. And while this therapy can be done outside of the clinic, they're difficult to do with the adequate load for eccentric training, and they allow for compensatory movements, which lead to ineffective exercise and even further injury. Customer discovery interviews reveal that patients don't feel comfortable progressing these kind of exercises on their own. They don't feel like they're doing them correctly without therapist oversight. That's why we developed BraceX, a smart, portable rehabilitation device that will allow patients to perform these eccentric exercises in the comfort of their own home, at work, or on the go. And it'll track their data and progress over time and share that remotely with their therapy provider. BraceX resembles the kind of brace a patient might wear with one of these injuries, except there's some extra hardware, something that allows them to perform these exercises with enough force for eccentric training and sensors to know how much they are exerting. And this is a connected medical device that will provide real-time visual feedback to guide the user to the right amount of effort based on their strength test, so they know it isn't too little or too much. Again, it tracks their progress over time, sharing that data with a therapy provider. Additionally, our software platform will collect rich context-specific data so clinicians can filter through patient profiles to make better, more informed return to sport decisions, reducing the risk of re-injury. Now let's take a look at the value proposition for BraceX. The 46% of patients who fail to meet their return to sport strength criteria goals will now be able to meet their rehab goals, get back to the sport with reduced risk of injury. For outpatient physical therapy clinics, they can increase their revenue by 80% for their knee pain patients by increasing the number of patients completing their plan of cares through patient engagement, by billing for remote therapeutic monitoring, and by replacing this kind of therapy with a higher reimbursed intervention while they're in the clinic. Additionally, this type of device can reduce the need for in-person visits, increasing clinic capacity. So now therapy clinics can get in higher margin evaluations, and that can lead up to $34 million in revenue for these clinics. And there are multiple ways we can bring BraceX to market and generate revenue. We're focusing on direct sales to clinics and rentals, where a physical therapy clinic can purchase a small number of devices and loan them out for remote therapy monitoring, and patients can rent this device directly utilizing HSA funds, significantly reducing out-of-pocket friction. And our software platform will be monetized on a revenue share program with participating clinics. That way it reduces barriers to adoption and aligns our growth with theirs. Considering all these different use cases, we're talking about quite a large market. If we look at the number of patients that can benefit from a device like this, assume a $50 a month fee for a 3-month period at a time, we're looking at a $1.57 billion market in the US alone, assuming a 5-year device lifespan. Our beachhead focus are the 46,000 outpatient physical therapy centers in the United States. And with the amount of patients that could benefit from a device like this, demand can support up to 7 devices a clinic, leading to a $155 million market opportunity. I'm Dan Stein, a physical therapist and founder of Thera Logics, and I'm joined by a team with deep expertise in biomechanics, device design, and software. And we're advised by Stefan Agamenos from the YBI and Michael Walster, the former CEO of Impact Applications. We have filed an application for a non-provisional patent application and refined the design of the device. And working with JLX Medical, this device was assessed to be a Class 2 510K exempt device, significantly reducing the time and cost to market. And we've been supported in this work by multiple grants and an initial investment by the Northeast Ohio Student Venture Fund. We are raising $500,000 to continue work towards our MVP, to perform the necessary regulatory testing, and to launch pilot programs. Thank you.
Thank you, Dan. Great job.
Thank you.
Any questions?
Michael Yogi. So with the piston that you're using, is it bidirectional? And then how are you going to right size it for the patient, considering you could have larger athletes like a male that's doing football versus a female that might be doing track and field? They could be very, very different strength curves on them.
Yeah, so it's a linear actuator and it is bidirectional. So the goal is for them to be able to do exercises on the front of their thigh and the hamstring muscle on the back of the thigh as well. And then the sizing of the device, there's some adjustability. We just did a redesign of the device and they're currently being manufactured where the cuff that contacts the skin, there's various sizes too. So a simple curve measurement to get them sized correctly. So one basic frame could then fit multiple different patients just based on the cuff size.
Thank you. Another question?
Yeah, I think I'm going to have a columnist council. Sorry if I missed what are the competitors? What are you competing in the market right now?
So the current main competitor is a Biodex machine. So it's an isokinetic machine, but they're $40,000 to $60,000. They're large, they're bulky, and they're very cumbersome to use. It takes a long time to set a patient up correctly on them, and then the clinic doesn't get any extra value from using that piece of equipment versus any other exercise that they might do too. So there's not much incentive for them to spend the time on setup. Where a device like this, it's easy to set up, the patient can go home with it, and they could actually get a positive ROI on that piece of equipment that they purchased.
Thank you. Thank you. Last call.
Is it possible to use it incorrectly? And does the device provide any feedback to make sure they're using it correctly?
Yeah, so when the user goes to use the device, they put it on much like a brace that they would have for any kind of like over-the-counter knee device. So there'll be indicators that make sure that it's lined up at the appropriate place in the joint, and then also a calibration sequence that it goes through to make sure it's going through the proper motion, and then they perform a strength test. So then it guides them to the right effort, so they can't incorrectly use it by overexerting, causing further injury as well. That's something that will progress with them as they get stronger, because each time they'll start out with that strength test.
Great.
But it guides them through the correct motion.
One more round of applause for Dan. Everybody. Thank you.